अथा तो गुल्मप्रतिषेधं व्याख्यास्यामः यथोवाच भगवान् धन्वन्तरिः. Gulma is a specific disease entity which Sushruta considers as a medical disease, whereas at certain conditions surgical treatment also is suggested at certain specific conditions. So possibly it's a condition where a medical disease may be converted into a surgical disease in progress into that. But that kind of a progress is not described in the text as the real stages like Gulma and Udara, Shula. See, these are not really described as sequential changes. But Sushruta has mentioned about Gulma and Shula as consequential instances. That since Shula can be produced, Shula is the acute pain could be produced as a complication of the Gulma. But the Udara is a separate disease condition. Whereas in the present days contemporary surgical field, we generally consider these sequential disorders as potential risks and we categorize all of them as surgical conditions. Now because of this perception, there is some confusion about the Gulma. But practically, if you look at what Sushruta has mentioned, there cannot be any confusion. The only issue only thing which we really miss is how to make out that clinically beforehand, before the development of the before the outcome comes in, to decide which of the condition is medical and which of the condition requires surgical intervention. That cannot be really made out with the current perception of medical approach or clinical examinations or even the investigations, and hence we consider all of such conditions as potentially surgical conditions and keep the finger crossed, try with the conservative management. If the conservative management fails, then we go for the surgical management. That's the approach which we have now, and we are accustomed to that kind of an approach, and that's why there is some confusion about the Gulma and the Udara. But if we categorize these conditions or separate these conditions, and if we develop that kind of a skill where we can make out which of the condition requires later surgical intervention and which of the condition can be managed purely medically, then there will be no confusion. With this basic introduction, Yasakte Kopane Dosha Kopida Kosmagata Janan Tinadan Gulmum Sapancha Vidhuchete. It's an abdominal disorder where the involved doshas they reach or locate in the abdomen and produce the lesion. Location of the Gulma is Hrbastyoho Antare Grandhi Sanchari Yadiva Achalaha Chaya Pachayavan Bruttaha Sagulmahiti Kirtaha. A granthi or a palpable mass which is produced in between Hridaya and Basti, that's the abdomen, the chest and the pelvic area. Now that's the area where these lesions are located. Of course, as far as from the grammatical point of view, there are two issues. Hrbastyoho Antare, this is a iteretara dvandva samasa. Now, if it is iteretara dvandva samasa, as per the text, this methodical grammar, it should be the in between the hridaya as well as or in the middle of the hridaya and in the middle of the basti. But this has to be interpreted in a different way. We have to consider as a samahara dvandva, though it's iteretara dvandva samasa. We have to consider the other way, like it should be in between hridaya and basti. Now, anyway, that's the grammatical point of view, and from the interpretation, it's better to interpret, maybe bypass that grammatical rule and consider this as the location in between Hridaya and Basti. Then, in the middle of Hridaya plus in the middle of Basti, that should not be the interpretation. Anyway, that's one of the modifications which we have to do. Anyway, a palpable mass which is either fixed or movable and which tends to have a waxing and waning course, Chayapachayavan, waxing and waning course, and where the borders are clearly palpable, that's Bruttaha, that kind of a mass is considered as a Gulma. Pancha Gulmashraya Handuna Parshya Sunnabhishasyaha. The abdominal anatomy, surface anatomy, in Sushruta's period was by dividing it into 5 segments, and that 5 segments would be Parshve, the two sides. Now, in the present day situation, we divide the abdominal wall into 9 segments. and that is drawn by drawing a line, or that's formed by drawing a vertical line from the mid-clavicular line to the mid-inguinal area or anterior iliac spine, and that makes the abdomen into 3 vertical segments. Then we draw 2 horizontal lines, and that horizontal lines, one is at the subcostal margin and the other is at the anterior iliac spine superiorly. So this way you make it 9 segments and name them with the different names. Now Sushruta's method of this division of the abdomen be by, of course, 2 vertical lines which make the 3 vertical divisions, and then there would be only one upper segment, that's the hridaya or the superior segment, and then one the lower segment. So instead of 9, Sushruta had considered 5. So the hridaya, nabhi, basti, see, and parsha, the parsha to hridaya, nabhi, basti. So these horizontal lines, if we limit only the horizontal lines into that middle segment only, and the sides are left out, then what Sushruta has said is the same. Of course, whatever I said as 9 segments is not the universal rule. Even now we categorize many times, for the sake of consideration at times, we divide that abdominal surface anatomy into the 4 segments also many times. Anyway, that doesn't make a huge difference, but that's about the perceptual differences. Now, Gupitanila Mulatpada, Guda Mulavayadapi, Gulma Udva Vishalapad, Gulma Itebiliyate. Gulma bird is defined as Gulma because of one, it has a similarity to the shrub plant, like where you will have some pedicle and then a wider roof like structure, and the whole lesion is produced due to a vata, abnormality of vata, and the total onset of the disease and the course of the disease also is very hidden, in the sense it is something where the causes cannot be easily defined, and hence it is called as a Gulma. Sa yasmad atmanisayam gacchatyapsuya buddhaha antasarati yasmat napakam upayatyataha. Now a disease condition where the organ directly is not affected, but it gets dilated and it looks like a bubble of water, and once that blocked contents are removed, the organs become normal. Such a lesion are what we call as the distended lesions conditions. Organs which become distended, any of the organs which become distended without the pathological involvement of the structure, such a condition is called as Gulma. And if you remove the cause of distension, the whole pathology could be reversed. That kind is considered as a Gulma. So in the contemporary science, you may not have such a separate category of the disease, but definitely we can identify many clinical conditions of that sort where a similar approach is possible. Savestaihi jayate doshaihi samastaihi uchrvaihi purushanam tatha strinam jinyo raktena chaparaha. The Gulma could be in the men, Tridoshaja, as well as that individual Vataja, Pittaja, Kapaja and Tridoshaja, whereas in the female, Raktaja also is considered. The Pururupa, prodromal symptoms of Gulma are Sadanam, Madanta, Vanehe, Atopaha, Sadanam, Madanta, Vanehe, Atopaha, Andravikujanam, Vinmutra, Anila Sangascha, Sauhitya, Sahatada, Besho, Ane, Vayu, Urdham, Chapuru, Beshu, Minam. The patient would have a feeling of dullness in the body, the digestive capacity would be affected, and the patient may have a distension and barborygmy. Andravikujanam is barborygmy, signs of partial obstruction at times. Vinmutra anila sangascha, constipation as or obstipation, and sautyasaha, intolerance to the food, and anorexia, dislike or dyspepsia could be the symptoms of Pururupa of Gulma. Now, in case of Vataja Gulma, Hritkukshukulam Mukhakanta Shoshaha, Vayoho Nirodha Vishamagnidacha, Tete Vikaraha Pavanatmakascha, Bhavanti Gulme Anila Sambhavetu. In Vataja Gulma, the patient would have acute pain in the abdomen, dryness in the mouth, and the patient would have also obstipation, failure to pass the flatus, maybe the stools also. The digestive functions would be affected, and that condition and all other Vata Lakshanas could be produced, like dryness of mouth and so on. That could be seen in case of Vataja Gulma. In the present day scenario, in all patients of acute intestinal obstruction, the intestinal obstruction would have many phases. Once the obstruction occurs, either due to intramural or extramural or mural causes, intramural in the sense obstruction produced due to something within the lumen of the intestine, or obstruction produced due to some external factors like hernia, adhesions, etc. So on, in such conditions, once the obstruction occurs, the issue is body tries to get over the obstruction by increasing the peristaltic wave. That's the first response. Once there is an obstruction, the first response of the body would be trying to get over the obstruction by increasing the peristaltic waves, and hence at that time the patient may have a pain in the abdomen due to every colic episode, and there could be a progressive distension. The next stage would be, if the obstruction cannot be relieved by that kind of effort, then the condition would be like there would be widening or dilatation of the proximal loop of the obstruction, and there is a tendency for the fluid to get accumulated. So that's the next stage. If it also doesn't, and at this stage the condition is reversible. So in the increased intra-abdominal pressure, and if the valves or intestinal valves are not affected, then it's considered as reversible and the loop would be viable. When we open the abdomen, we will see that the loops would be viable in the sense that they can be reversed. So there is a extent of the viability. If the condition progresses, if the condition cannot be reversed, then the dilatation goes on increasing by addition of the fluid into the abdomen, lumen of the intestines, as by reverse osmosis, as well as all that fluid content and the secretions of the intestines also get accumulated. So luminal pressure increases to such an extent that the circulation becomes blocked. The abdominal, these intestinal walls becomes stretched, and the venous as well as the arterial circulation may become blocked, and then it becomes a non-viable loop or strangulation occurs. So in all cases of intestinal obstruction, there is always a risk of strangulation occurring in the later stage, and hence we consider all cases of obstruction as a potential surgical risk. And it is not possible there is no definite means of predicting which of the conditions can result in this strangulation or not. Of course, we have defined clinical signs of identifying a strangulation which has occurred, and we also have defined signs of identifying non-viable and viable loop. But prediction is difficult, though there are some statistical instances like adhesions. They rarely result in obstruction, strangulation. Hernia, they tend to produce strangulation much earlier than others, so on and so forth. That's about the statistics, about the predictability. But there is no possibility of an accurate prediction. Whereas Sushruta had categorized those conditions which would not go into the non-viable limit and which can be reversed at the beginning itself before they go into the viable limit, then that condition could be considered as the Gulma. Now, radiological evidences of the intestinal obstruction usually mentioned are the dilated loops and the fluid levels in the intestines. Once you see the fluid levels in the X-ray, that means there is a very high possibility of a non-viable loop and surgical exploration would be necessary. But if there are no fluid levels seen, only the dilated loops are seen, and the proximal loops the distal loops are normal, then it's quite possible that the patient might not have gone into the non-viable limit or strangulatory limit, and there is still a possibility of conservative management. The usual conservative management now, what we do is keep the patient orally and then aspirate the fluid contents from the through the Ryle's tube and maintain the patient on IV fluids, and a good number of patients can be recovered from that point of view. The only issue is now we keep the finger crossed, keep the patient under observation, and once the patient recovers, we say that the patient has recovered. If the patient doesn't recover or progress to the next stage, we go for the surgical intervention. Whereas Sushruta had some clinical skill of predicting which of the condition would be reversed, and that condition which can be reversed is considered as Gulma, and those conditions which cannot be reversed and which may result in a established obstruction would be considered as a Udara. So the point is, with all the technology, we are not in a position to make out this prediction accurately as Sushruta has done. Anyway, that's about Vataja Gulma. The next part is about the Pittaja Gulma. In the Pittaja Gulma, Sveda, Dvara, Ahara, Vidaha, Daha, Trasnangaragaha, Katuvatratacha, Pittasya Lingani, Akshilani, Ani, Pittatmike Tani Bhavanti Gulme. Pittaja Gulma would be presented with the systemic features of the fever, burning sensation, or even there could be the changes in the color of the body. Katuvatrata, the oral taste sensation would be having that pungent smell. All Pitta Lakshanas can be produced in such condition. That's called as Pitta Gulma. Now that's exactly seen in case of cholecystitis. There was a error of typing. It's not mesenteric cyst, it should be cholecystitis. Some error of typing there. Now, anyway, in the different stages of the cholecystitis can produce due to inflammation of the gallbladder. What we see, the normal gallbladder as a shining, smooth surface structure. Once the gallbladder is inflamed in the initial stages, the gallbladder becomes distended, but the walls of the gallbladder still not become thickened, and that condition is medically curable. And there may not be a calculus. A calculus cholecystitis is medically manageable. Even now we consider this as medically manageable. But if the gallbladder becomes distended so much and the walls become thickened, or maybe the walls become fragile, or even there could be empyema of the gallbladder where there could be pus formation, that condition is considered surgical. So decision about a surgical intervention or a medical management of a cholecystitis would be depending upon whether the gallbladder wall has become thickened or not, or whether there is a calculus or not. If there is a calculus stone there, then it's a high possibility that it may result in the later complications of the gangrenous changes in the gallbladder, or maybe the empyema and so on, and that condition is essentially surgical, whereas the other condition is medically manageable. And what we, again, as I have told you earlier, in the present day situation, we consider every patient of cholecystitis as a potential case to go for the surgical risk and keep the patient under observation, and then decide, though certain factors like the thickening of the gallbladder wall, presence or absence of the stones would predict the need for surgical intervention. And the classical method or the conventional method of grading the gallbladder cholecystitis, and maybe possibly to decide like whether there is a need for surgery or not, we usually grade into 5 categories, and the 5 categories are the first category is where there are no adhesions present and visibly normal gallbladder, and second grade is where there is a minor adhesions at the neck and otherwise normal gallbladder. So, these are medically curable and there is no need of surgical intervention at that time. If there is hyperemia or pericholecystic fluid, adhesions on the body and the gallbladder is distended, we keep the finger crossed, keep the patient under observation, and then decide like whether the surgery is required or not. If there is a severe adhesions obstructing the major portion of the gallbladder, and there is an abnormal liver anatomy, intrahepatic gallbladder with impacted stone, or presence of perforation, necrosis, or inability to visualize the gallbladder due to adhesions, in such conditions we consider them as a surgical condition. So essentially surgical condition, and many of these emergency surgery is required. So in the present day situation, we have some methods of analyzing like which of the conditions require surgery or not. Sushruta had identified those conditions which do not require surgery as the Gulma, and those conditions which require surgery as Udara. Then comes the Kafaja Gulma. In the Kafaja Gulma, Stymityam, Anya Aruchi, Angasadaha, Chardihi, Praseko, Madhurasiraja, Kafasti Lingani Chayantani, Bhavanti Gulme Kafambaveto, Sarvatmaka, Sarvaikarita, Sadhyuktaha. Now, in case of the Kafaja Gulma, there would be a heaviness and anaruchi, anorexia, and even vomiting, there is more of salivation and a taste, abnormal taste in the mouth, sweet taste in the mouth, and so on, and kapha lakshanas like heaviness and maybe a thing also may be presented. Now these conditions can be seen in any of those conditions where there will be a passive dilatation of the organ. Very commonly seen conditions are the mesenteric cysts. Mesenteric cysts are those conditions where the mesentery tissue becomes cystic and there will be dilatation, which is usually painless. There could be only heaviness. Rarely it produces an obstruction to the intestines, and only there will be a palpable mass. Or a similar issue also can be seen in hydatid cyst of the liver or ovarian cyst. In the hydatid cyst, there will be a parasitic cyst like echinococcus would produce the dilatation, and there again there would not be much pain locally because it's gradually distending. It produces issues. Ovarian cyst also. The majority of these cystic conditions can be managed by simple aspiration, putting in a needle and then aspirate the fluid content. Majority of these conditions can be managed, and some of the conditions may require a surgical excision. Cyst may have to be excised, or some of the conditions may require marsupialization, like as in case of pseudocyst of the pancreas. So majority of these cystic conditions could be considered as a kaphaja. Then tridoshaja are mainly the malignant cysts are the tridoshaja. Then kshatajam pravasya, raktaja are navaprasuta ahita bhojanacha yaya chamagarbham visuje prasava वायुर्हि तस्याः परिगृह्य रक्तं करोति गुल्मं सरुजं सदाहं पैतस्य लिङ्गेन समानलिङ्गं विशेषणं च अपि अपरं निबोध न स्पन्दते नोदरमेति वृद्धिं भवन्ति लिङ्गानि च गर्भिणीनां सगर्भकालातिगमे चिकित्स्यम् असृग्भवं गुल्मं उशन्ति तज्ञाः. Now, the hydatid for mole, or what we call as molar pregnancy. Molar pregnancy is an aberration either due to the genetic pathology or due to some abnormality of the system conditions, and it can occur either after a perfidum delivery or due to amagarbha, that's abnormal product of this fertilization in the uterus, which results in a mass in the uterus and may have similar symptoms as that of pregnancy. That in the sense it gradually increases, the size of the uterus increases, resembling that of the issue, and there could be the other signs of pregnancy also, like vomiting and so on, which may produce a confusion. In Sushru's period, there was no ultrasonography which can make out this molar pregnancy and the normal pregnancy. Differentiation was not possible so easily, and to avoid a risk of possible injury to the fetus, live fetus, Sushru had suggested to deal with that condition only after the full term of pregnancy is over. So by 9 months, if there is no evidence of pregnancy or there is no fetal movement, in that condition we will consider this as a kshatraja or raktaja gulma. Whereas now the molar pregnancy can be identified much earlier by ultrasonography, where we can see that mass, and the causes for the molar pregnancy could be either genetic, where there could be a formation of abnormal genes or genetic combination at the time of the fertilization itself, where more than one of the gametes they meet together, it can result in molar pregnancy. Or molar pregnancy also could occur due to the other pathology, like having the invasive pathologies, or choriocarcinoma also can present as a molar pregnancy, or many times the trophoblastic tumors also may look like molar pregnancies, and these are characteristically seen. And the treatment now, of course, is excision. Now that's about the types of the gulma. Now, management of the gulma according to Sushruta would be Vatagulmarjam snigdham yuktam sneha virechanehi upachare yathakalam niruhehi sanvasanehi. In Vataja gulma, you have to give snigdahara and sneha virechana, and niruha and anuvasana have to be given. Pitta gulmarjam snigdham kakolyadi kristena cha to viriktam madhurihi yogehi niruhehi samupachareta. In the Pittaja gulma, you will have to give kakolyadi or pittahara chikitsa, virechana and madhura dravyas to be given in the form of niruha. Shleshma gulmadidam snigdham pippalyadigritena tu tikshnehi viriktam tadrupehi niruhehi samupajareta. In Kaphaja gulma, pippalyadigritha and tikshna virechana has to be given. Sanipato tride gulme tridoshagno vijarihidaha. Sanipata gulma, tridosha gulma is considered as asadhya, but still you have to manage with the tridoshahara yogas. Now certain specific then rakta gulma pittabal rakta gulminyaha naryaha karyakriya vidhi vishesham aparachasyaha shunu rakta vibhedanam palashaksarato yena siddham sarpe prayojeta dadyaduttarabastincha pippalyadigritena tu ushnerva bhedeyetu bhinne vidhi asragdarohitaha. Now, in Raktaja Gulma, Sushil suggests like a Palasakshara, a Uttarabasti Palasakshara, or any other Rakta Bhedana Chikitsa, any other treatment which can produce Rakta Veda, and Pitta Gulma like treatment has to be given. And once the bleeding starts, you have to treat it as a Asudhara. Of course, in the current situation, we may not go for that kind of an option. We may often prefer either curating, DNC, or maybe the hysterectomy, depending upon the type of gulma. Anupa udaka madhyana vasa tailam gasundati vipakam ekadashastam vata gulmyanu asanam. Now specific yogas, in case of vataja gulma, anupa and audaka animals madhya, vasa, taila, snigdha pradartha have to be given for the anvasa. Jangala ekashapa namtu vasa sarpischa paitike tailam jangala madhyana evam gulme kafothite. In the Pittaja gulma, the vasa or the snehadravya could be Jangala prani, animals in the Jangala Pradesha. Ekashapa is those who have only one hoof, like sheep, where there is no bifid sheep hoof as such. That's the Ekashapa. Sheep mainly. Such and their vasa or sarpi, their the mansarasa or sarpi has to be given. Then Jangala Madhyana in Kafaja variety. Jangala pranis, animals of Jangala Desha, and their taila and madhya can be used. Dhatri Palanam Surase Sharangam Vipajetam Sharkara Saidhopitam Tantitam Matakulmine. In Vatajibulma, another of the yoga, Dhatri Palasurasa with the Sharanga Grita. Chitraka Vyosha Sindutta Prithvika Chavya Dadi Mehi, Deepeka Granthika Ajaji Hapusha Dhanyaki Samehi, Dati Aranala Badara, Mulaka Sarasi Gritam. Tadvivet Vatagulmagni, Durbalde Atopashul, another of the Grita Yoga, Chitraka, etc. in Vatajagulma. Then Hindu Savarchala, Ajaji, Vida, Dadima Deepekehi, Pushkara, Vyosha, Dhanyamla, Vetasa, Kshara Chitrakehi, Shati, Vacha, Ajagandha, Yela, Surasesha Vipachitam, Shula Anaharam Sarbi, Dadnacha, Anila Gulminam. Another of the yoga which can be given with the either Dhaji currents or Grita. In Vatajagulma. Vida Dadima Sindhutta Hutabhuk Vyosha Jirakehi Hindu Savarchala Kshara Rubruksha Amla Vetase Amlamla Vetasehi Bijapura Rasopetam Sarpihi Dadichatur Gunam Sadikam Dadikam Nama Gulmahasta Priha Shula Jita. Another of the Dadhika Yoga in the sense Daji Yoga current preparation with the drugs. Rasana Surase Sarpihi, Panchamula Sadanvitam, Sura Aranala, Dadhyamla, Mulaka Surasehi Saha, Vyosha, Dadima, Vrikshamla, Yavani, Chabya Saindhavihi, Hingu, Amla Vetasa, Ajaji, Deepakesha, Samamshikehi, Siddham, Gulma Grahani, Arsha Shwasa, Unmata Kshaya Jurana, Kasa, Apasmara, Mandagni, Priha Shula, Nilan Jayeta. Another of the yoga which can be given in many diseases like Grahani, Arsha, Unmada, etc. where Rasona Swarasa with the Gruta is given. Dadhi Savirakam Sarpihi, Kwatho, Mudga, Kulathajo, Pancha Adakani Vipacheta, Avapya Dipalani Atha, Savarchalam, Sarjika Mucha, Devadaru, Atha Saidhavam, Vatagulmapaham Sarpihi, Etha Deepanamacha. Another of the Vatagulmahara yoga, Dadhi Saviraka, etc. तृणमूल कषाये तो जीवने ही पचेत घृतम निक्रोधादि गणे वापि उत्पलादिके रक्तपित्तोच्चलं गुणन्ति घृतानि एतानि असंशयम् रक्तज and पित्तज गुणमहर योगा where तृणमूल कषाय with जीवनीय द्रव्य is given आरब्धोधादौ विपचेत दीपनीय युतं घृतं क्षारवर्गे पचेत अन्यत् पचेत मूत्रगणे परं घ्नन्ति गुल्मं कफोद्भूतं घृतानि एतानि संशयम्. In the कफज गुल्म आरब्धोधादि गण and दीपनीय द्रव्य are used with the क्षारवर्ग. Yatha doshochayam japi chikitsayat sannipatikam. In the sannipatika gulma, depending upon the lakshanas of doshas, you have to formulate the yogas. Churnam hingvadikam vapi ghritam va plihanashanam pibet gulmapaham kale sarpihi tailvakamevacha. Hingvadi churna or pliha grita can be given. Tila ikshuraka palasha sarshapam vyavanalajam. भस्म मूलकजं चापि गोजा आभि खर हस्तिनां मूत्रेण महिष्याणां च पालिकैश्च अवचूर्णितैः कुष्ठ सैन्धव यश्चाह्व नागर कृमिघातिभिः स अजमोदैश्च दशभिः सामुद्राच्च फलैर्युतम् अयः पात्रे अग्निना अल्पेन पक्त्वा लेश्यम् अथ उद्धरेत् तस्य मात्रां पिबेत् दध्ना असुरया सर्पिषापि वा धान्याम्लेन उष्णतोयेन कौलथ्येन रसेन च गुल्मान् वातविकारांश्च क्षारोऽयं हन्ति असंशयम्. Another of the Kshara Yoga, where the Kshara Dravyas of different varieties along with the urine of different animals also are used, and it's prepared in the form of leha, and then Kshara Yoga is given. Sarjika Kushta Sahita Ksharaha Kaitakijopi va Tailena Shamayat Pito Gulmam Pavana Sambhavam. Another of the Gulmahara Taila. Pitam Sukhambana Vapi Sarjika Kushta Sahindavam. Surgical kushta can be given along with water for consumption of liquid. Vrishchivam urubhukam cha varshabhu brihati dvayam chitrakam cha jaladrone pakva padavasheshitam magadhi chitraka kshaudralipte kumbhe nidhapet madhunaha prastam avapya prathya churna arthasanyutam pusoshitam dashaham tu chirna bhaktaha pivennaraha aristoyam jayet gulmam avipakam arochakam. Another of the Arishta Yoga. पाठ निकुंभ रजनी त्रिकटु त्रिफलाग्निकं लवणं वृक्षबीजं च तुल्यं स्यात् अनवो गुडः पथ्याभिः वा युतं चूर्णं गवां मूत्रयुतं पचेत् गुटिकाः तद्घनीभूतं कृत्वा खादेत् अभुक्तवान् गुल्मप्रीह अग्निसादांस्ता नाशयेयुः अशेषतः हृद्रोगं गृहणीदोषं पाणुरोगं च दारुणम्. Another of the Vati Yoga, Gutika Yoga, which can be given for treating many conditions like Gulma, Priha, Agni, Mandya, Hridroga, Grahani Dosha, etc. Sashure, Sa Unnate, Aspande, Dahapakurganate, Gulme, Raktam Jalokabhi, Sira Mokshena Vahareta. If there is painful and immovable Gulma, which tends to have suppuration, in such conditions, Rakta Mokshana is indicated with the Sira Moksha, with either Jaloka or Sira Moksha. Sukoshnaha, Jangalarasaha, Susvikdaha, Vaktasindavaha, Katutri Samahita Hita Panet Gulminam. Another of the Pana Yoga, where it can be given as the regular drinks. Peya Vataharihi Siddhaha Kaulathaha Samskritaha Rasaha Khalaha Sapancha Mulashta Gulminam Bhojane Hitaha. Khala is a sort of preparation which is something like khichdi, where the different substances are added together and this preparation is done. Baddhavarcho Anilanam cha Sardrakam Kshiram Shide Kumbhi Pinda Istakas Svedan Karayet Kushalo Bhishaka Shunki Kshirapaka, and local fermentation with the either a vessel or a brick, so on. Local fermentation is suggested. Gulminaha Sarvayoktaha Dupidi Chitamaha Prisham Atashchetam to Susvinam Samsanen Upavadeta. The Gulminaha considered as Durvirecha. Durvirecha word could be considered as or interpreted as two possibilities. One is it's difficult to produce Virechana, and other is the complications of the Virechana also are more. You have to be more careful, and hence Sushil says you have to use Mruda Virechana in such conditions. Of course, another interpretation is you have to give the Tikshna Virechana because they are difficult to be produce fermentation. But from my opinion, and it's quite obvious, like the Durvirecha has to be considered as a situation where the possible complications will be more, and hence you have to be careful, and it should be the Mrudu Virechana. Some of the other way interpretation would be Durvirecha is considered as a condition where it's difficult to treat and you have to give a Tikshna Virechana. But most practical could be a Mrudu Virechana would be a better option set. Vimlapana Abhyanjanani Tasaiva Dahanani cha Upanahaschya Kartavyaha Sukhosnaha Sarvanadaya Udaroptani Sarpumshi Mutra Vartikriyastata Lavanani cha Yojani Yani Uktani Anirame. Now other protocols like local Vimlapana or rubbing over the area, Abhyanjana or Agnikarma, Upanaha or any other Udaroik Bhrutas, Mutravarti yogas also can be given. Pibe Trivat Nagarama, Sagudama, Haripatim, Gukulam, Trivutam, Dantim, Dravantim, Saindhavam Macha, Mutra, Madhya, Payo, Draksha, Rasehi, Vikshapalabala. The another of the combination of the drugs which can be given as a supplement to the food with the Guda and Haritaki, Gugulu, Trivut, etc. Evam Piluni, Bristani, Pibe, Salavana, another of the suggestion food supplement. पिप्पली पिप्पलिमूल चव्यतित्रकसैन्धवेः युक्ता हन्ति सुरागुल्मं शीघ्रं काले प्रयोजिता. Another Sura Yoga where Pippali use. Bhagdavinmar Gulmi Punjita Pesa Yavan Kulmashan Va Bahusnehan Bhakshet Lavanottaran. Another of the Kulmasha, that's the food preparation which can be given. Athasya Upadrava Shula Karinchitupayate Shulam Nikhanitam Iva Amukham Asukham Vyetyaso. The Sushruta has considered Shula as a complication of Gulma. Now this is a very important issue. Any of such dilatation conditions which you have discussed, like a ovarian cyst, mesenteric cyst, or maybe the gallbladder, it may get twisted upon, torsion, and then there could be acute pain produced, and that acute pain produced is suggestive of involvement of the organ, where either there is a impairment of the vascularity, or there could be a mechanical pressure increases, or a complication of rupture of the cyst, and hence that's considered as the complication of the Gulma. So any of those possible conditions can result in a possible complications as such, and Sushruta considered that as a Shula. So Shula, according to Sushruta, is a complication of Gulma. Though in other texts the word Shula is used for other non-surgical conditions also, where there could be acute pain. तत्र विन्मूत्र संरोधः कृच्छ्वश्वासः स्थिरांगता तृष्णा दाहो भ्रमो अन्नस्य विदग्धपरिवृद्धिता रोमहर्षो अरुचिः छर्दिः भक्तवृद्धिः जडांगता वायुवादिभिः यथासंख्यं मिश्रैर्वा. The Shula, once it produces that kind of a complication where there will be acute abdominal colicky pain and produced as a result of any dilated organs becoming twisted or having the impaired vascularity and so on, it produces signs of toxicity, breathlessness, and the abdominal rigidity would occur. That's exactly the clinical symptoms even now. And excess of thirst, dryness of the mouth, signs of dehydration, and vidagdha parivardhita, that's the leakage of the fluid into the abdomen. Leakage of the fluid into the abdomen is resulting in free fluid in the abdomen. And Romaharshaha, Aruchihi, Chardihi, Bhaktavruddhihi. Bhaktavruddhi is a stagnation of the food in the intestines and hence dilatation. These can occur with the Dosha Lakshanas. Vatavarcho nirodhetu samudra ardaka sarshvai krutva paya vidhartavya vartavya marichottaraha. In such conditions, one of the options is to facilitate the passage of the stools. You give a suppository with the samudra ardaka sarshvai, with irritated substances like salt and sarshapa etc. Dandi chitrakamuleshu tatha vatahareshtya kuryad aristan sarvansha shlokasthane tejitan. The arista yogas also can be tried. Khadedvapi ankuran dristan putika nrukshayoho. Then urdhvatam manushyanta gulminam cha niruhe, na niruheta. If the patient has vomiting in Gulma, in such condition niruha should not be tried. Then Viksha Yojayata, the other drugs which can be given considering the status of the patient would be Pathya, Trilavanam, Ksharam, Hingu, Tumbura Paushkaram, Yavanima, Haridrama, Vidangani, Amlavetasam, Vidari, Tripala, Abhiru, Shrungati, Gudasharkaraha, Kashmiri, Pala, Yashtyafa, Parushaka Himancha, Shadgrantha, Atibisha, Daru, Pathya, Maricha Vrikshajana, Krishna, Mulaka Chabyam, Naga Kshara Chitragana, Ushnamla Kadika Kshiratuyehi, Shloka Samapanana, Yathakramam Vimishtanscha, Dagde, Sarvesh, Sarvamsha Sarvaje. The another set of the yogas, which are present in one of the shlokas, could be given depending upon the status of the patient. Tathaiva, Seka, Avagaha, Pradeha, Abhyanga Bhojanam, Shishira, Udaka Purnanam, Bhojananam Tadharanam, Vamana, Unmardana, Sweda, Landana, Kshapana Kriyaha, Sneha, Dishtakrama, Sarva Visheshena Upadishade. The other total local management like application of or fomentation or keeping the patient in a warm water or local application of lepas or abhyanga application of taila or selecting typical food or vamana and swedana, langhana, these can be given as the other option. Valluram mulakam marsyanu shushka shakani vaidaram nakhaded alukam gulmi madhurani palanicha. A patient with Gulma should not eat the fish and the typical type of the food like Vallura, Mulaka, the vegetables like Vallura and Mulaka and Shushka Shaka. Any dry food should be avoided. And monocotyledon substance, Vaidala is monocotyledon substance should be avoided, and aloo, potato also is avoided in case of gulma. Bina gulmena shulam gulmasthanesh jayate nidanam tasya vakshami rupam sachakipsidam. Now, a shula also can be produced without gulma. Those who should have considered gulma as primarily a complication of the gulma, the shula also can produce due to conditions other than that of gulma. Abdominal pain could occur due to other conditions, and those causes are वातमूत्र पुरीषाणां निग्रहात् अतिभोजनात् अजीर्ण अध्यशन आयास विरुद्ध अन्नोपसेवनात् पानीयपानात् क्षुत्काले विरूढानां च सेवनात् पिष्टान्न शुष्कमांसानाम् उपयोगात् तथैव च एवं विधानां द्रव्याणाम् अन्येषां च उपसेवनात् वायुः प्रकृतितः कोष्ठे शूलं सञ्जनयेत् भृशं निरुच्छ्वासी भवेत्तेन विरणापेतो नरः. This is a very important issue. Clinically, every patient presenting with the pain in the abdomen is not to be considered as a complication of gulma. A pain in the abdomen also can be produced as a condition other than that of the gulma, and Sushila has not named that condition as a shula vyadhi, but as a shula lakshana produced due to multiple causes, and they could be due to improper excretion of the platters, stools, urine, etc., or due to excess of food, or indigestion, or consumption of food over the before the previous food is suggested, or excess of exercise, or viruddhahara, consumption of viruddhahara, non-synchronizing food or antagonistic food, or consumption of water when you have more hungry, a hungry man drinking water, or if you eat sprouting seeds, then pishtana, flour, prepared with the flour, maida and so on, or shushka mamsa, dry flesh, consumption of such dry food as such, or what you call as junk food, it can result in vata prakopa and pain can occur. And the pain would be Shankaspotanavattasya yasmat tivrashya vedanaha shulasakta selection yasmat shulam vihochyate, because it produces a pain which looks like as if there is something which is penetrating in and ruptures in. The pain would be severe, and that's called as a shula, and which we now call as a colicky pain. We consider that word, use the word colicky pain when there is an acute episode of pain. And this pain can be produced in case of Vataja Vyadhi, Nirahara Sesya, Kivam Shulam Mudirete, Prastabhagatra Bhoti, Krichena Muchasrivacha, Vatamutra Purishani, Krichena Purdianara, Etilinge Hivjani Yanta Shulam, Vatasamudbhavam. When there is an acute colicky pain produced due to Vata, and often this occurs when the lumen is obstructed, as in case of biliary colic, renal colic and so on. Typically the patient would avoid movement, prastabhagatra, they avoid movement, and it may not be related to the food. And Sushila has mentioned when it occurs in an empty stomach, not necessarily empty or not having a relation with the food, is a typical signs of the colicky pain produced due to some obstructing phenomena in any of the lumen, and the patient would have a difficulty in passage of the stools. That's exactly. So, Vataja Shula is colicky conditions of the abdomen which are produced due to some obstructive pathologies. Then, Trishna Gaho Madhu Murcha Tivram Shulam Tadevacha Shitabhigamo Bhavati Shiteneva Prashamiti Ete Linga Vijani and Shulam Pittaram Bhav. Pitta Shula are those conditions where there could be an inflammatory pathology like appendicitis, cholecystitis like conditions, and the patient would have a severe colicky pain or even pancreatitis like conditions where the systemic signs like fever and burning sensation would be there, and the patient would prefer to have a cool environment, and with the cold it can be reduced. Then Shulena Uppidamanasya Hillasa Upajayate Ativa Punakostotum Reba Gurugatra Etas Krishna Samuttasya Shulasya Uttam Nidarshanam. A Kapaja Shula is the pain produced due to dilatation or distension of the lumen of an organ, and where there could be relatively dull aching type of the pain, and the patient would have fullness in the abdomen. So, colicky pain produced due to, or a pain in the abdomen produced due to acute colicky condition can be considered as Vataja. Pain in the abdomen produced due to inflammatory conditions can be considered as Pittaja. Pain in the abdomen produced due to some distension of the organs of the body can be considered as Kapaja. Sarvani Drishwa Rupani Vidishet Sanipatikam Sannipata Samuttanam Asadhyam Vanirvishet Shulanam Lakshanam Proktam. These are the clinical signs of Shula. In the present situation, we approach the patient presenting with the pain in the abdomen by mainly two approaches based upon the location, area where the pain is felt, and the other is the types of pathology which can produce the pain. Now, depending upon the area of the pain, as the 9 segments, in each of the segment where the pain is produced, and the conditions which can produce the pain are mentioned in this chart. And when the patient has a pain in the epigastrium, it's usually produced due to maybe the stomach gastric pathology, or many times even the chest pathologies can present with that. And suprapubic area, it's usually the bladder pathology which produces that. Then based upon the pathologies, lesions, usually we categorize as the gastrointestinal causes like gastroenteritis, appendicitis, mesenteric lymphadenitis, and so on, and the hepatic pathology like liver, spleen, biliary tract disorders, etc. Genitourinary causes, metabolic disorders like diabetic ketoacidosis, hematological disorders like sickle cell anemia, hemolytic or uremic syndromes, drugs and toxins like erythromycin, lead poisoning, etc. Pulmonary causes, pneumonia and diaphragmatic pleurisy. Miscellaneous causes, at times it cannot be made out functional pain. Pharyngitis also can present with abdominal pain. So, a condition presenting with abdominal pain needs a careful history and analysis, and the cause has to be ascertained, and based upon the cause, the management has to be done. Now, the principles of the management according to Sushruta is चिकित्सां तु निबोधमे आशुकारेः पवनः तस्मात् तं त्वरया ध्येयेत् तस्य शूलाभिपन्नस्य स्वेद एव सुखावहः. Sweda is one of the options of reducing the pain. In a colicky pain, increasing the temperature or making that warmth area may produce a counter irritant phenomena, and the patient would have some relief of the pain. Then payasaihi krisharapinde snigdharvapishite, that Swedana can be done by payasa, that's the eatables or any other food substance which are warm kept over the area. Till shaken was snigdam usnam bhunjita bhojanam chiravilvankuran vapi tailabdhastan pakshet vaihangach rasan snigdhan jangalan shulapiditaha yatha labham nisheveta vamshani bilasarainam. Food which can be given in a patient with a pain in abdomen would be triple shaka, etc. For vegetarians, for non-vegetarians, the rasa prepared out of birds and jangala animals, or bilashayi, that's the animals like rats and rodents, their fresh can be given. Sura savirakam chukram mastu udashvit tatha dadhi sakala lavanam peyam shule vasam dve. The milk products like curds and whey water with the saviraka could be given. And kala lavana. Kulathayusha yuktamlaha lavaki yusha samskritaha sasaindava samirajo vatashula vinashanaha. Another Kulathayusha yoga has to be given. Vidanga Shiguru Kampila Pathya Shama Amlavetasana Surasam Ashwamutrima Savarchala Yudan Viveta Madhyana Matajam Shulam Shipramema Prashamyati. Vidanga, Shiguru, etc. can be given as a bit prepared with the Madhya. Prithvika Ajadi Chabika Yavani Vyosha Chitrakaha Pipalyaha Pipali Mulam Saindavam Cheti Churneta Tani Churnani Paisa Pibet Kambalikenava Madhu Asavena Chukrena Sura Savirakenava Athava Etani Churnani Matlungarasenava Tatha Badara Yushena Bhabitani Punapunaha Tani Higut Pragadhani Saha Sharkaraya Pibeta Saha Dadimasarena Vartik Karyabhishakita Sa Varti Vatikam Shulam Shipameva Pohati Gudatelenava Leadhaha Pitaha Madyenava Punaha. Different Varti yogas and Vatis also can be given in the patients of Shula. Bubuksha Prabhave Shule Lagu Santarpanam Hitam Ushne Shiri Yavagubi Snigdi Mamsarasestada. Acute pain also could be felt when the patient would have severe hunger. A hunger pain also could be the cause. And in such conditions, light nourishing food has to be given. Then Vatashula Samutpanne Ruksham Snigthena Bhujeta Susamskritaha Pradeyaha Syuhu Kasapuraha Visheshataha. Puri is to be prepared with the Krita has to be given in Vatajashula. Atha Pitta Samutasya Kriya Muksham Param Sasukham Chardetva Pitva Shitodakam Naraha Shitalancha Seveta Sarva Krishnani Vardeta. Pitta Jashura Vamana can be given, and cold water, and all Ushna Vija Dravyas have to be avoided. Mani Rajatatamrani Bhajanani Sarvashaha Vari Purnani Tanyasya Shulasya Parikshpeta. In Pitta Jashula, cold fermentation has to be done. गुडः शालिः यवाः क्षीरं सर्पिपानं विरेचनं जाङ्गलानि च मांसानि भेषजं पित्तशूलिनां रसान् सेवेत पित्तज्ञान् पित्तलान् विवर्जयेत् पालाशं धान्वनं वापि पिबेत् यूषं सशर्करं परूषकाणि मृद्वीका खर्जूर उदकजान्यपि तत् पिबेत् शर्करायुक्तं पिबेत् पित्तशूलनिवारणम् in pittashula other shita yogas are to be given. Now as far as when the hot fermentation would be helping and when the cold fermentation would be helping, we have discussed earlier in the Sutrasthana that if you refer to that, you can have more detailed approach of when a hot fermentation is prepared and when a cold fermentation is prepared. In inflammatory conditions, of course, cold fermentation is a better option. अशने भुक्तमात्रे तु प्रकोपश्लैष्मिकस्य च वमनं कारयेत् तत्र पिप्पलीवारणाभिषेक in वातज कफज गुल्म वमन has to be given. रूक्षः स्वेदः प्रयोजव्यः स्यात् अन्याश्च उष्णाः क्रियाहिताः पिप्पली शृङ्गवेदं च श्लेष्मशूले भिषेक्जितं कफहर yogas are to be given. रूक्ष स्वेद also has to be given. पाठां वचां त्रिकटुकं तथा कटुकरोहिणीं चित्रकस्य च निरुह्ये पिबेत् युषं सह आर्जकम्. Another of the yoga which can be used in kafaja shula. Eranda paramulani moolam goshura shalaparani prishtaparani bhratim kantakarikam dadyat sugala binnam cha sahdevam tatheva cha mahasaham kshudrasaham moolam ikshurakasya cha etat sambhritya sambharam jaladrone vipachayet chaturbhagavashesham cha yavaksharayitam pipeta vatikam paidikam vapi shlaishikam sannipatikam prasakshya nashe shulam chinnabram iva marutaha. Another very potent yoga for all varieties of the shula according to Sushruta. Pippali swarjikaksharo yavaha chitraka evacha sevyam cha etat samaniya bhasma kuryat vichakshanaha tvadushna varana pitam shleshma shule bhishakritam. Another of the kshara yoga. Then runabhi martam shleshma kukshi parshvavasthitah sasamruddha karotyashu sardhanam gudugudayanam suchi bhiyo nistodam krutchvachvasi tada naraha nanam vachati न निद्राम उपेति अर्तिनिपीडितः पार्श्वशूल सविज्ञेयः कपारिल समुद्भवः. Another of the variant of the shula is parshvashula, which is due to obstruction of passage of vata and kapha and usually seen in parshva. That's exactly what you see in case of renal colic, where the patient would have acute pain and difficulty in breathing also and anorexia and he is not able to sleep and so on. That's a typical scene in case of acute renal colic. And that's considered as parshvashula according to Sushruta. Tatra pushkaramulani hingu savarchalam vidam saindhavam tumburum pathyam churnam krutva payeta. The specific yoga for the parshvashula is pushkaramula hingu etc. Then parshva hridbasti shuleshu evakvathena simitam sarpihi prihodaraktam va ghatam va hingu samitam bijapurakasaram va payasa sahasartam eranda tailam athava मध्यमस्तुपयोरसैः पूजयेत्यापयसा चाङ्गलेन रसेन वा. The food which has to be given in such patients of the parshvashula. प्रकुप्य जलाकुक्षौ वह्निम् आक्रम्यमार्धः तदास्य भोजनं भुक्तं सोपस्तम्भनं पच्यते उच्चस्थिति आमशकृता शूलेन आहन्यते तदा नैव आसने न शयने तिष्ठन्मालभते सुखं. कुक्षिशूल इति ख्यातः वातात् आमसमुद्भवः. आमज कुक्षिशूल which is produced to overeating, and because of the indigestion there will be pain in the abdomen, which is often seen when you go to a party and so on. And in such conditions the patient would have very severe discomfort and he is not able to take rest even. In such conditions treatment would be vamanam karayet tatra langhayedva yathapalam samsargapajanam kuryad amgaihi deepana sanyutehi. In such conditions vamana is to be given and langhana according to the condition of the patient, and pachana dravyas vidut deepana dravya have to be given. Nagaram deepakam chavyam hingu savarchalam vidam matulungasya bijani tata shyama urupukayoh bruhatyaha kantakaryascha kwatham shulaharam pibeta. Another of the shulahara kwatha vacha savarchalam hingu kustam sati visha abhaya kutidasya bijani sadya shulahara cha virechane prayita jnatva doshapalavalam. Another of the yoga which can be given for the shula in such conditions. Then snehbasti nirvahascha kuryat doshan nirbarharana. Snehbasti yogas also are suggested in the treatment of other shulas. The उपनाः स्नेहसेकाः धान्याम्बपरिसेचनम् अवगाहश्च शस्यन्ते यच्च अन्यदपि तद्धितम्. The other local fermentations are local uses of upanaha, snehaseka, parisechana, avagaha, dipping the patient in liquid could also be the other options. Kapha pitta avaruddhastu marato asamurchita hridistha kurute shulam uchvasa arodhakam param sahritshula iti khyataha rasa marata sambhavaha. Another of the variant of the shula is a hritshula, and there the patient would have pain in the chest due to abnormal passage of vata, pitta and kapha, and often produced due to rasa and vata. Tatrapi karma bhitam yaduktam hridvikaranam. All hridroga protocol is to be followed. Samrodhat kupito vayu bastim avritya tishtati basti vamshananabhishu tada shulo asya jayate vinmutra vata samrodhi basti shula samarudhat. Another variant is basti shula, where there would be real obstruction to the passage of the urine as well as the stools. So retention of the urine would be the other feature, and in such conditions the treatment would be nabhyam vamshana parshveshu kukshav metrantamardagah mutram avrite pranati mutashula samarudhat. Bastishula and mutashula, in those conditions there will be retention of urine, and hence that patient would have a pain. वायुः प्रकुपितो यस्य रुक्षाहारस्लेहिनः मलं रुणद्धिकोशस्थं मन्दीकृत्य तुपावकं शूलं सञ्जनयेत् तीव्रं श्रोतांसि आवृत्य तस्य हि दक्षिणं यदि वा वामं कुक्षिम् आदाय जायते सर्वत्र वर्धते क्षिप्रं ब्रह्मन् न च सघोषवान् पिपासः वर्धते तीव्रा भ्रमो मूर्छा च जायते उच्चारितो मूर्छितश्च न शान्तिम् अधिगच्छति विट्शूलमेतज्जानीयात् भिषक् परमदारुणम्. A vitshula which is considered to be very severe, and it's due to improper passage of the stools, retention of the stools in the abdomen, and it may present in the sides, lateral portions of the abdomen, in the lumbar region, either on the right or left side. And in such conditions, in all such conditions, kshipram dosharam karyam vishajat sadhyanata swedanam shamnam jiva niroha sneha visleha purvodishtan payete yogan koshvishodhanan udavahtpaharashta kriya sarvaha sukavaha. In all such conditions of obstructions, you will have to give shodhana chikitsa as per the condition of the patient. Swedana and shamana aushadhi, niruha basti, sneha basti also have to be given. Atimatra medhabhuktam pavake mritam gate sthiri bhutam satkoste vayu akriti tishtari avipakagdam hyannam shulam tivram karotyapi murcha atmanam hridah virahasya hridukkleshah vilambika virichyate chharte kampate api vimukhyate avipakar bhavet shulam tu annadosha samudvaha. Annadosha samudva is a pain produced due to food poisoning, where either it's due to the excess of the food or abnormal food taken. Patient would have vomiting, diarrhea, as well as maybe unconsciousness, impaired consciousness, and systemic symptoms of toxicity. Vamanam langhanam swedah pachanam phalavartaya ksharah churnani kutika shastante shulanasanaha. In all these conditions, all the protocol like vamana, langhana, swedana, pachana can be given. Gulmavastha kriya karyaha yathavat shulinam. All the protocols of the Gulma Chikitsa also can be applied in Shula Chikitsa. इति सुशीलसंहितायां मुद्रितग्रन्थे कायचिकित्सातन्त्रे गुल्मप्रतिषेधो नाम चतुर्थोऽध्यायः आदितः द्विचत्वारिंशो अध्यायः. With this we will conclude. If there are any questions, we will try to answer. Yeah, there are some questions. Please elaborate on treatment protocol for Pittaja Gulma. Now, Pittaja Gulma, if I have to give a prescription, I would give Agnitunde Arogyavardhini Kumaryasava, like in cholecystitis. Whether the patient would require a antibiotic course or not, that depends upon the toxicity signs. If the total leukocyte count is more than 16,000, I would be using an antibiotic along with the Agnitunde Arogyavardhini Kumaryasava. Then there is another question like, why should we avoid niruha in urdhvavata? So in already a patient who has a vomiting and retrograde peristalsis, anything given by rectal can aggravate the condition. There is virtually no indication for that anything given rectally. Probably that would be the reason why all niruhavasti are indicated in urdhvavata. Urdhvavata is a retrograde peristalsis, and in all those conditions where there is a retrograde peristalsis, there is no logic in administering anything from rectal route. I think with this we can conclude.